Well, hello. Behind the mask, it's Dr. Davin Turner. I'm the Chief Medical Officer for Mosaic Life Care and the President of Mosaic Life Care here at St. Joseph. And I wanted to talk to you today about some of the issues around COVID or the things around COVID that are going on presently. So today we eclipsed a mark of 41 patients in the hospital with COVID, and that is our highest number. But I want you to be assured that we are capable of managing these 41 patients and that this is a safe place to come and receive your care. We have been preparing now since March for the COVID pandemic to increase in number of patients. And what we are seeing in our community is an increase in the positivity rates of those being tested for COVID-19. With those increased number of patients being tested for COVID-19 turning positive, we are also seeing an increased number of patients presenting to our hospital and requiring hospitalization. We want to be incredibly transparent about how many tests we're doing, what the positivity rates are, and also how many folks we have in our hospital. What have we been doing in our facility? In the emergency room, back in March, we actually converted our ambulance bay to an overflow area. That area will be utilized to help provide space for patients to be able to be socially distanced and also be able to receive care in a rapid fashion. So you will see us utilizing this extra space in our ER as we did early on in the COVID pandemic. This allows also our caregivers to be able to triage and place folks that are coming here to receive their care in a more rapid fashion. Our ER staff, our caregivers, they have worked tirelessly since March to provide the best and safest care. They have all of the appropriate equipment, and they are there for you to take care of you whenever you are ill. So please do not delay receiving important medical care if you are in an emergency situation. From a hospital standpoint, what should you know about our ICU and our pandemic floor? Our 5th floor on the main tower is our pandemic floor. There are 48 beds of negative pressure rooms on that floor. This is a place where we can cohort our COVID patients and provide them with the safest care, along with protecting our caregivers and our visitors and our other patients in our hospital. We have the ability to move to the 4th floor if needed. So from a overall operation standpoint, we have the ability to take care of a large number of COVID patients while still providing safe care. And also, I want to reassure everyone that we are here and available to you to provide you with this care. It would be very important to not delay care because the number of positive patients in the community with COVID has gone up. Again, as a facility, we are able to accept patients and we are not turning patients away. Our ICU is also set up with a COVID plan. We presently have one section that we utilize for COVID patients. However, if the number of COVID patients requiring intensive care treatment goes up, we are able to expand into other areas. Our ICU staff have been working tirelessly, and I believe that if you have ever seen the video of our first patient that spent an incredibly long time here in our hospital, he attributed his ability to survive to the wonderful care provided by our nursing staff. And that's not only the ICU, not only on 5 East, that includes our whole facility. What are our physicians and our APPs and our PAs and CRNAs and physicians and dietitians and all those that work here? Our cleaning staff, they are working tirelessly to make sure that our facilities are clean and safe to receive care in, and also deliver safe care out in the community. Our clinics that are out in the community work tirelessly to provide telehealth visits, phone visits, and also have patients come in where if you only require testing, they are arranging for you to drive up, and sometimes they will come out to your car to collect that testing or arrange for you to enter the buildings safely. I want you to know that we want to be incredibly transparent. We are not trying to deny you any of the information, and that's why I encourage you to go to our website, go to the COVID resource area, and it will give you the information around how many patients that we have, what protocols are we presently using. We do still limit visitation, and we really feel bad that we have to do any limitation of visitors. However, if you really look across the Kansas City area, our visitation policy is more lenient than most facilities. We are allowing folks receiving care here to have a support person, and we are also allowing visitors in the general floor area. We are not allowing visitors to our COVID patients except under very special circumstances, at which time we will work very collaboratively with the families, with the patients, and with our caregivers to make sure that they can see and speak with their loved ones. We are also working to provide them with the ability to do FaceTime using devices that we've provided here, and we will assist visitors and families to be able to communicate with their loved ones while they're here in our facility. Again, I'd like to close by thanking all that work here, all the staff, again, from the cleaning staff, dietary staff, our cafeteria workers, our nurses, our techs, our physicians, our APRNs, our CRNAs. Everyone is working so hard to be here to serve you and serve our community. And we continue to be able to do that in a very safe and protective fashion. So with that, please take care. Please wash your hands. Please wear a mask. Be thoughtful when you're going to be out. Be thoughtful if you're going to be in a large group. Please try to social distance. These are the important things that you need to be doing to protect yourself and your loved ones through the rest of this pandemic. We hope to have a vaccine by the end of the year. However, most likely this vaccine will not be available to the whole general public until middle of next year. So again, continue to protect yourself, your loved ones, and others that you come in contact with by wearing your mask, washing your hands, and social distancing. Thank you.